with the holidays. But for those of you who don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health. I'm a member of the Thrive Kentucky campaign, and my voice is starting to come back. So hopefully y'all can understand me and I won't start a coughing fit in the middle of all this. It is really hard to believe that we have made it to the end of 2021 already. I literally feel like it was just the beginning of the year. And we were so excited about vaccines on the horizon and all of that. And now we've gone through all these different variant outbreaks and have the Omicron variant kind of threatening to interfere with our holidays and set back our recovery. But I hope everybody is hanging in there. Not to mention that we are less than a month out from the beginning of the 2022 General Assembly, which means that we have a lot to get you up to speed on today. By now, most of you are familiar with the Thrive Kentucky campaign. Kelly, yeah, thank you. And our core purpose, which is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for those reasons, we advocate for policies that are both anti-poverty and anti-racist. And you can see our shared principles on this slide, which we actually recently revisited and updated a bit. So you can see in blue underlined kind of the tweaks that we've made to our principles. And let's go one more slide, Kelly. These are the members of our campaign. We can skip to the next slide. And I want to say thank you to our 2021 sponsors. It's great to have the support for this work that we do, and it helps us to make this a free webinar every month for our members. And we also have been able to provide CEUs for community health workers and licensed social workers because of this. So thank you very much. And if you are part of an organization that wants to consider sponsoring our 2022 series, please reach out to us. You can reach out to me or to Kelly, and we'll get you some more information. And then here's the agenda that we'll be covering this afternoon. We really want these webinars to be an opportunity for you to get the latest information on the state and federal response to COVID-19 and other things that are going on with our economy and our healthcare system and so on. And to get updates on our safety net program, share feedback, ask questions during each section as we go along. Please just put your questions and comments in the chat. We find that that works better than stopping, for Q&A along the way. So we'll cover those as we go. If we have more questions than we can get to during the next 90 minutes, we'll be sure to get you some written answers to those. So don't let the clock stop you from asking your questions. And before we begin, just some quick housekeeping. We have a lot of folks on the webinar today, so please be sure to mute your line. We are recording this, so we'll get a link to that recording as well as any materials and an evaluation out to you in a follow-up email probably tomorrow. So you can watch for that. And if you are a certified community health worker or a licensed social worker and you'd like to receive CEUs for today, just send an email to Kelly and she'll work with you to make that happen. And with that, I'm going to turn it over to our first speaker, Dr. Sheila Schuster.
Thank you very much, Emily, and good afternoon to you all. I'm Sheila Schuster. I'm a licensed psychologist and executive director of the Advocacy Action Network, which includes the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. So we thought it would be helpful to recap the legislative interim session, which is ending this month, and then give you just a very brief overview of the upcoming session. We'll be each month delving into much more of the legislative action or inaction as it happens. So next slide, please, Kelly. So the interim session runs from June to December, and most of the committees have stopped meeting at this point. The interim used to be solely to look at bills that did not pass in the previous legislative session, but it has gotten to be much bigger, broader than that, much more active than that. So it typically focuses on what I call the kind of big picture items. So they can't take action on any specific bills, but very often they'll take up a topic in a committee meeting and spend some time either in that committee over several meetings, or that same topic will be kind of vetted through a number of different committees. And they're looking at some of the pre-filed bills as well. So if you're bringing up a pre-filed bill, you've got a topic that hasn't been seen before in the legislature or not seen recently, very often the bill sponsors and the advocates around that issue will ask for time in the relevant committee to kind of give them a preview or pre-warning about what the bill is about. We know that there will be a lot on COVID's impact, and there already has been in the during the interim. There's been an awful lot on the workforce shortages, particularly around nursing. So there have been multiple discussions in different committees about those. We also are getting lots and lots of requests around funding. And so sometimes the interim budget review subcommittees are hearing lots of those funding proposals. Next, please, Kelly. So the other thing that the interim is increasingly known for is its task forces. And those of us that are working on a particular problem or particular population of Kentuckians that we think need to be focused on, we kind of push to be the subject of a task force. These are groups of legislators. Sometimes they include non-legislators, but I think almost all of the task forces this interim had only legislators on them. And they meet every month for several hours to receive information, to discuss a given issue or problem, and then to look at some solutions to address it. So these are the task forces that met during this current interim. The county clerk office, modernization around your county clerk. So think about the county clerk's office where you renew your driver's license and your auto license and do all kinds of things. And apparently they probably are looking for more funding, so they put it in terms of a modernization. Pari-mutuel wagering taxation, and many of us were looking at this with some interest because of the historic horse racing bill that passed in the last session. The racetracks were really desperate to have that legislation passed, and many of us on the advocacy side and some legislators felt like the taxes on the earnings or the winnings that the horse racing industry gains from those should be taxed at a higher rate and bring in a steady stream of revenue. They did not do that at the time. They passed the historic horse racing bill anyway without it. So this pari-mutuel wagering taxation task force was going to look at that issue. I think that their recommendations, and I'm going to show you how to get to those on the LRC website, I think did not actually recommend any taxation, which was too bad. There was a huge task force around school funding, and they met sometimes for 3 and 4 and 5 hours once a month. And they were looking at all of the sources of school funding and how it gets allocated. So you can imagine that that's such a significant part of our budget, and it's very complicated. They were not looking at new requests for funding, but they were looking at what we've got and getting a real good fix on where it's coming from and how it's been used. My favorite of the task forces, and the one that I've been pushing for probably the past 3 or 4 or 5 sessions, was on a population that's been really underrepresented and overlooked, and that's our Kentuckians who have severe mental illness. So those are folks who have what we used to call psychotic disorders. They have difficulty in differentiating between reality and delusion and so forth, and they have a difficult time with housing, with employment. And so this was a very productive task force, and with a lot of good information provided. We know that there's been a huge amount of uproar around the unemployment insurance office and how it hasn't worked. Most recently when we needed it during COVID, but we also know that it has a long history of being held up by, I guess, 1970s hardware and software, which has created much of the problem. So there was a very important task force that was looking at that. And then this next task force actually met during the interim of the 2020 session, but met again because they didn't think they had gotten any place. The 1915C home and community-based waivers are for people, Kentuckians with intellectual or developmental disabilities or physical health disabilities who need intensive care and want to stay in the community. So it's a way of people getting community services without having to go to a nursing home or to a facility. So hugely important to a growing number of Kentuckians. Next slide, please, Kelly. So each of those 6 task forces will issue a report of findings and recommendations, and they technically go to the Senate President and to the Speaker of the House. They're then distributed and made public. And each of them then summarizes the information presented at the task force meetings, describes their findings, and then lists out those recommendations. And typically the intent of each task force is to take action on those recommendations. I didn't try to summarize those. Some of those have not quite been made yet, but I did show you on here how you can go and get the ones that have been produced. So you go on the LRC website and go to committees and then special committees and then to meeting material. And I just realized I didn't close my quotation marks there, but just imagine that it's closed after material. And you could pull up those task findings and so forth. And it also lists the members of the task force. So if you see a recommendation that you are particularly interested in, I would recommend that you contact the co-chairs. They have a Senate and a House co-chair of each task force and members of the committee and tell them that you're interested in working with them on that particular recommendation. Next, please, Kelly. So we'll move out of the interim session, which, as I say, is winding down in the next week or so, and get ready for the regular session, which opens on January 4th. So this is our biannual long or 60-day session, and they have several required actions that they need to take. Typically in the 60-day session, they pass a biennial or 2-year budget. Every 10 years, they have to approve redistricting maps for the state house and state senate seats and for the congressional house districts. And you may have been reading in the news where the Republicans in the legislature have wanted the governor to call a special session so they could do that before January 4th. And the governor has said he doesn't want to do that without looking at what the maps are, because the maps have not been made public and have not been made known to the Democratic or minority members of the House and Senate. So they're at a standstill. It's obviously not going to happen at this point. So the first thing that happens when they get in on January 4th is that they're going to have to approve their redistricting maps and send them over to the governor for his approval. In all likelihood, they'll be vetoed by the governor, would be my guess, on either constitutional grounds or something like that. So they'll be going back and forth about the redistricting maps. In the meantime, the current deadline for a candidate to certify that they want to be on the ballot is January 7th. Well, obviously you can't do that if you don't know what your district looks like. And we know that there was a loss of Kentuckian population from far east and far west Kentucky. So the population centers are moving much more toward the center. So it's possible that there are going to be House members, even of the same party, that are going to be in the same district in the new maps and will be running against each other, or part of their district may be there and part of their district may be someplace else, and it depends on where they live. So all of that's up in the air. The other thing I didn't put in as kind of a deadline is the legislature in the special session set January 15th as their kind of self-imposed deadline for the public health emergency around COVID, and that's the expiration date. And they will have to look and see if they want to extend that, because it has implications for other statutes and regulations, probably for some funding decisions that they need to make. Next, please, Kelly. So many aspects of the budget. We think those of us in human services, as I say, I'm a psychologist and lobby for people with mental illness and substance use disorders and disabilities and so forth. Thrive is all about the benefits that people need to have healthy, safe, supportive lives. And all of those areas have been underfunded for years, despite growing need. So we have many task force recommendations are about funding, either around SMI and disabilities or around education. There are remaining American Rescue Plan Act funds that need to be allocated. You remember that there's been a dispute between the governor and the legislature about who has the authority to do that. What we're hearing from the majority party is a lot of talk about putting more money into what they call the rainy day or reserve fund, kind of like your savings account, which is already funded at a higher level than it's ever been funded. And so to put more money in that when we have lots and lots of unfunded needs is, I think, problematic for most of us who are advocates. And there's even been talk about tax cuts, quote, because we have so much money. Well, we may have a lot of money right now, but that doesn't mean that we ought to be cutting revenue in the long term. So a lot of concern about the talk about rainy day investment and also tax cuts. So be on the lookout for those discussions. Next, please, Kelly. So lots of things around COVID, I think. There will be continuing debate, I think, around vaccinations, around masking, around the role of public health, and certainly some funding, some legislation possibly around the healthcare workforce shortages. And it's not just nurses. The SMI task force pointed out a significant shortage of psychiatrists and particularly child psychiatrists. I think in the Commonwealth of Kentucky, we have 26 child psychiatrists in the entire state and 500 psychiatrists, which is way fewer than we need for our population. I know as a psychologist that we have a shortage of psychologists across the mental health professions. We also know that COVID has exposed significant health disparities that we really need to be examining and addressing, not just noting them. The governor's done a great job from day one with COVID of noting them. There's been legislation passed in the past session to start having the cabinet do a better job of counting some of these disparity measures, but now we need to do something about it. We also know that COVID has absolutely exacerbated mental health crises and significant addiction problems that are only going to increase. And you'll hear more about that in the behavioral health portion with Marcy Timmerman. We also know it's shown us a significant shortage of affordable housing, which we always knew was there, but it's been made worse again with COVID, particularly for those of lower income or those with special needs. And it's exposed some infrastructure issues across our health system, and particularly in public health. So COVID has done some things that could be a wake-up call for us if we take advantage of it and do something about it. And then I think I have one more slide, Kelly, please. So there's some good health policy out there. There's a bill pre-filed, and there probably will be other legislation around creating what they call an all payers claims database, so that all of the payers, Medicaid, commercial insurers, state insurance plans, all put their data into one pool to create transparency and accountability. It will give consumers a whole lot more information on which to base their choices. Will also help administrators and policymakers decide where the gaps are, not just by anecdote, but in terms of data. We also are very excited about some legislation that Representative Kim Moser is going to bring forward to allow community health workers to be reimbursed through Medicaid. And these are trusted people in the community that do terrific outreach, education, and care coordination. So again, at the really ground level, where people aren't sure sometimes if they need to see somebody, where they should go, how they get there, how they find out what their coverage is. CHWs are just an incredible resource. There'll be legislation to increase the number of mental health professionals and also nurses in our Kentucky schools to try to shore up students, and also staff. Our teaching staff are really struggling with COVID and the return to school. And then finally, to address the health inequities and disparities in health access and outcomes, with a lot of emphasis on maternal and child health. That's one of the places where we've seen so many disparities, particularly among our Kentuckians of color. So I think that's my last slide, Kelly. Yep, it is. Please put your questions in the chat, and I'm happy to try to answer them later on. And I'll turn it over to friends Dustin and Kara. Thank you very much.
Thanks, Dr. Schuster. I think that I am up first in this blended together section, and we are going to jump to what has happened in Washington, D.C. and what that we hope will continue to happen. So that's kind of my role here today. Go to the next one, Kelly. So, we've gone over these bubbles. Every time we have one of these, there's been something else either happened or almost happened. And this time we have had, where we are is we're at the very end of the line. We are so close. We just need the Senate to pass the last piece of all of this for the Biden administration's Build Back Better plan, which is good legislation that will help lots of Kentuckians. So that's where we are. We passed the what was commonly called the bipartisan bill, which was really the Infrastructure Investment and Jobs Act. It originally passed the Senate back in August with pretty good 69-31. It passed the House, and then President Biden signed that into law with an extra W in my slide for some reason on November 15th. But then now we are looking at the next bill, which, go to the next slide. Not this one. I put that in the wrong order. I apologize. These are things that have already happened that I wanted to make sure we still recognize and notice. This is still in place. It has not gone away. You're still, the child tax credit is still a big deal. It's still changing families' lives in Kentucky every month. And if you haven't gotten yours updated, please do. If you have children, it is $300 per child per month for under 6 and $250 per month for over 6. And now I understand why Kelly asked me about that order, because she was right about that. So Build Back Better in Kentucky is got a lot on the table for Kentuckians. It has got paid family leave. It adds in a bunch of money for that. It keeps the child tax credits going, and it makes sure that every 3- and 4-year-old has free childcare or preschool, which is a big, big deal, because we know that a lot of people that aren't in the workforce right now aren't able to be in the workforce because of childcare. They also, some of them aren't able to be in the workforce because it costs money to go to work. But childcare is definitely a big piece of the puzzle. And then, of course, being able to get better jobs needs more skills and education. And so this Build Back Better also includes tuition-free community college, which is also a game changer for, a lot of Kentuckians. I've got this in another slide, so we're going to go ahead and go on, Kelly. So let's dig into some of the healthcare components. So this bill passed the House November 19th. I'm sure you all probably saw there was quite a bit of drama. There was, kind of a tantrum that was thrown as a part of the process, but it passed the House on Friday morning, November 19th, and now it just needs to pass the Senate. And it includes everything that I've already mentioned, plus it includes a new coverage option for adults in the coverage gap and non-expansion states. Of course, Governor Steve Beshear expanded Medicaid in Kentucky in 2013. Which was, that's not us, but that does mean our neighbors. So we have a lot of neighbor states, and I'm sure folks have friends and family in those states that would affect directly. It also improves a whole lot of things for maternal and child health and advanced equity. So ensuring that new mothers have access to comprehensive health services for 12 months, making serious investments to end the maternal health crisis by the key provisions in a prior existing bill called the Black Maternal Health Momnibus Act. Forgive my pronunciation if I got that one wrong, but there's a lot of anti-racist and equity-driven provisions in there that get included. And then, of course, they're going to address churn, which is when people fall off and they shouldn't, and preventing children from becoming disenrolled by requiring 12-month continuous coverage for all kids, which would also be great for Kentucky. And increasing our K-CHIP program, increasing that up to 300%. Would also be a big deal for those families in the margins there. That could really change some lives. And we can go on, but I'm just trying to make sure that what you hear is this bill is good for Kentuckians. It does make permanent the wonderful improvements to the marketplace from this year. I don't know if you all have been talking to anybody who's been shopping for their coverage, but things are better out there this year. ARPA improved the slope for tax credits. Improved it into a way that really is meaningful to Kentuckians. Even this morning, I had a lady basically crying on the phone because she just couldn't believe that that was how much their healthcare was going to cost, and that it already included all of her doctors and medicines. And that was because of ARPA directly. And this would also make that permanent. So it also does some of the things we've already gone over. And then you're going to hear more about what it does for housing and home. It's a little bit of home care down the road. And just a friendly reminder that it is paid for by taxing rich people and corporations. So this is paid for, and that has been worked out. But like I said, it still needs to pass the Senate. Everybody here knows who that is for us. Our senators, Senator Mitch McConnell and Senator Rand Paul. Of course, you will get this slide emailed out to you. And if you've been here before, I'm sure you already have it. And that contact info is a clickable link, but here's all of the different offices. I highly recommend calling a local office. Oftentimes, DC is hard to get into, but you will get a real person in some of the in the state offices. So those are included on there too. So Dustin threw in there that the child tax credit will go away at the end of the year if Build Back Better doesn't pass. And that may be what needs to be our big takeaway, because that is such a direct change for so many Kentucky families. And I think Dustin will talk to us more about that as he dives a little deeper into childcare in Kentucky.
Excellent transition. So yeah, again, Dustin Pugel, I'm with the Kentucky Center for Economic Policy. We're a nonpartisan nonprofit research group out of Berea, but we work all across the state. And I wanted to take a little bit of time to talk about an issue that I think a lot of us are familiar with, but we don't do a whole lot of updates on during these webinars, but I think we'll be hearing a lot about during the General Assembly and also as Build Back Better continues to move through the process. So a lot of this research is based off of a report that we put out recently, and I will drop a link in the chat to that report in case folks want to see more. But, one thing that I think, as Kara mentioned, we've heard a lot about is just the fact that childcare has been incredibly difficult for folks to find, and that has been a barrier to a lot of things, including people's participation in the workforce. And there's been research about this for years, going all the way back to 2012. 17% of families reported income disruptions because of difficulty finding childcare. And that's only gotten worse during the pandemic. And I'll show a slide in just a minute to kind of illustrate that. But now as many as, I think it's 34% of families, particularly Black and Hispanic families, have reported, employment disruptions because they can't find a safe, quality place to put their kids. 50% of Kentucky is a childcare desert, and that's just a small area where there's either no childcare capacity or there's 3 times as many kids as there are childcare spots. For, if any of you are parents, I'm sure you've ended up on a childcare wait list at some point. I know I've ended up on a couple of those. There's 326,000 kids between the ages of 0 to 5, which are the majority of the kids who use childcare. Obviously, older kids use it too for after school care and summer care. But right now, there's only capacity for 165,000 kids. So many of those stay home with their parents, and that's good. But for a lot of parents who need to go to work, we have a very limited amount of childcare. And when it comes to actually getting help for paying for that childcare, the numbers are even smaller. Only 25,000 kids participate in the state's Child Care Assistance Program, or CCAP. And that is for many reasons, one of which is that the income thresholds are very low. It's 160% of the federal poverty level, which is just not enough. So let's move on to the next slide. This has always been a problem. That map I showed you is from 2018, but things have only gotten worse since then. So since 2012, 46% of childcare centers have closed. There's been sort of a really steep decline, or there was a steep decline for the first couple of years after 2012. And since then, it's really just sort of been a slow trickle, so that now we have almost half the number of childcare centers as we had, a decade ago. And part of the reason for that is that public subsidy only comprises about a third of center revenue. And that's an issue, again, because we are a relatively poor state. And not only that, but I'll mention this again in a little bit. Parents of small kids are at both their lowest earning years and at the time when they have the highest expenses, be it, car payments or student loans or mortgages. And so it's really difficult often to afford what can essentially be a second mortgage. Childcare costs as much as a full-time tuition at KCTCS, and nearly as much as Western Kentucky. And again, we'll get into that in just a little bit. And so because it's both expensive and it's hard to afford, childcare centers really have to squeeze costs. And so that's led to really poor job quality among childcare workers and really high turnover. 98% of all occupations earn more than childcare workers. Childcare workers also have the highest debt to income ratio of any other workers, because in order to be a certified childcare worker, you have to have some level of training, and that often comes with student loans. And so they are not only poorly paid, they're also straddled with debt often, so that they can take that job. And the average childcare worker who is part of a family of three actually earns so little that they qualify for childcare assistance. The average wage in Kentucky for childcare workers is about $20,000 a year. And that was in 2020 when it actually went up substantially over years before that. And of course, like this will not be any surprise to us, that burden falls mostly on women and disproportionately on women of color. And so what happens is childcare centers inevitably have to deal with very high turnover. Estimates from the Federal Reserve say between 26 and 40% of childcare workers quit every year, which is a huge burden on the childcare centers, but it's also difficult to be able to maintain quality for kids as kids have to get used to new teachers. Often teachers are often inexperienced, even if they have some training. And it becomes a really not only an issue for center employers, but also for the quality of care that kids receive. So let's move on to the next slide. Like I mentioned before, childcare is really expensive. I think I made the comparison to KCTCS in Western Kentucky. This graph here shows essentially what childcare actually costs. It's that dark blue bar on the sort of left of each of those for infants, toddlers, and preschoolers. But really what we know is that childcare, it only makes a big difference in kids' lives if it's high quality. And high quality care requires things like smaller classroom sizes, higher teacher pay, better learning environments, time for teachers to plan lessons, and so forth. And that comes with a price tag that most families can't afford, and certainly few centers are able to provide. And so although we want really high quality so that we can have really good outcomes for kids immediately that follow them all the way into adulthood, we rarely get those kinds of outcomes. And what that means is that we really need substantial public investment so that we can be able to provide that in a point in parents' lives when they're not able to afford it. So let's move on to the next. What happened over the last couple of years, though, is that we really saw an incredible proof of concept for what bold federal spending can mean for childcare in Kentucky. So between three big federal relief packages, the CARES Act, the CRSSAA, which was the December relief package at the end of 2020, and ARPA, is over $1 billion in funding. And that funding was used to make direct payments to childcare centers. It was used to improve teacher pay. It was used to make improvements to the actual physical learning spaces where kids were. as well as provide things like PPE and training and so forth. And so it's been really revolutionary for the industry as a whole, which means that it's been really good for Kentucky's kids. And I think in large part is we can thank this federal money for halting the slide that we saw at the beginning of 2020 of childcare centers closing their doors. Now, this funding came all within the course of a year, but we have until 2024 to spend it all. And so there is a lot of opportunity to be able to make a real difference in the childcare industry as well as in children's lives. But at that point, that money runs out. And so what we really need is a sustained, continuous entitlement for childcare. And with that comes Build Back Better. So let's go on to the next slide. So what we really need to do is build back better childcare. Now, the Build Back Better plan has sort of two phases and how this would work. The first phase is a 3-year ramp up of our existing grant that pays for childcare assistance. And with each increase in funding comes an increase in the amount of income you can earn and qualify for that. So in the first year, this next federal fiscal year, it would go to 100% of the state median income, which is about $52,000. The year after that, it's 125%. And the year after that, it's 150%. And folks who earn under 75% of the state median income would pay nothing for childcare, and folks who earn above that would pay no more than 7% of their income. Starting in 2025, however, there would be a brand new childcare subsidy that they're calling an entitlement, which essentially means that if you qualify for it, you're entitled to the benefit. And that would apply to all families up to 2.5 times the state median income, which is about $130,000. And they would pay no more than 7% of their income on childcare, and that 75% threshold would stay the same. All of that means that 85% of families with small young children would qualify for this, and 1/3 of those families would pay nothing, which again, I can't emphasize enough how big of a deal that would be, not only for the industry, but for our kids. And so all that said, when you get the slides, go back to Kara's slide with the phone numbers for our lawmakers and let them know that this is something that we really need both immediately and for Kentucky's future.
All right, well, with that, I can talk about housing assistance and homeless services. Next slide, please. Okay, so throughout this time, we've looked at the 211 for Metro United Way as kind of a proxy for what is happening with Kentucky renters. We know that about 1 in 4 of the calls in 2211 remain for housing and shelter. And again, of the housing and shelter requests, rent assistance, I realized I skipped a couple words in there, actually remains at almost 70%. So while emergency rental assistance is getting out to folks, the need is still pretty deep. Next slide. Okay, and you can see kind of the geographic and socioeconomic and racial breakdowns of who is behind on rent, who has been impacted the most throughout the pandemic. And you can see the zip codes essentially remain the same in the West End and South Louisville. Next slide. So we want to remind folks that rental assistance is still available in Louisville. If you have a court order, you go to Stop My Eviction. There is a whole process for folks who have a hearing date. In Lexington, the link is there and will be in the slide. And then in the rest of Kentucky and the other 118 counties, the Team Kentucky Healthy at Home Eviction Relief Fund, which is being run by Kentucky Housing Corporation, is still in place. We do not expect to run out of money. And then the other thing that we want to make sure that people are aware of is that with this type of rent relief, if the landlord chooses to not receive the back rent owed, which is an incomprehensible choice to most of us, the tenant or the renter can still receive that money and have it be paid directly to them. Now, the landlord has to refuse it. It has to be documented several times, et cetera, et cetera. But the bottom line is, if your landlord refuses to participate in this program, you can still receive assistance. Next slide. Okay, so because we are in Frankfort and we're in what's called the Balanced Estate, we've been looking at the Healthy at Home Eviction Relief Fund. And Kentucky Housing Corporation has been really good about sharing data with us. And so we've been tracking kind of where the spending is going. You can see overall the trend line is going up, and about half of the total grant, which was $264 million originally, has been obligated at this point. Now, some money has been directed to Louisville and to Lexington to bolster their eviction relief funds. But the bottom line is we're not going to run out of money. We just need to get it out into the hands of those who need it. Next slide. Here is just a recap from the last time we were here, and just going over the rental assistance eligibility for the Healthy at Home Eviction Relief Fund. And there's a maximum of 15 months, that's over a year. It also pays for utility assistance as well as internet, which is a utility as far as I'm concerned. Next slide. All right, so the Housing Assistance Fund, Kentucky is getting $85 million to help homeowners who are behind on their mortgage. And right now, the state has submitted their plan to the to the Treasury Department, and they're awaiting approval. So as soon as this program is operational, I know Kentucky Housing Corporation, which this will serve all 120 counties, will be getting that information out, as will the Homeless and Housing Coalition of Kentucky. Next slide. So some of you may have heard last week, the Department for Community-Based Services at the state made an announcement. They have been working on a low-income household water assistance program for the past 6 months or so. This is special ARPA money that has been given to states. States have to issue a plan, just like we talked about with the Homeowner Assistance Fund. And this is for people who are behind on water, wastewater, but we want to make sure that we're clear. It's really for people without a rental payment. So if someone has a mortgage, or maybe they don't have any sort of payment, if they're living on heirs property, but they are behind on their water or wastewater bills, this program is for them. So you want to contact Community Action, the local program, or you can go to that link that'll show you the network of community actions across the state. Next slide. Okay, so there are so many good things in the Build Back Better Act that Kara and Dustin have highlighted. And I just want to re-emphasize there are some really great housing provisions in the Build Back Better Act that we need in this country. As Sheila said at the beginning, COVID has really shown just how much need we have for affordable housing for Kentuckians and for people just especially who are lower income or have special needs. The Build Back Better Act includes historic investments in our housing infrastructure. Right now, it still includes $90 billion to expand rental assistance, which is huge because only 1 in 4 families who would otherwise qualify for housing assistance receives it the way it's currently funded. It also helps stabilize our public housing infrastructure, which has been defunded since the Nixon administration. And then it also directs $37 billion for the National Housing Trust Fund. And this is money for homes that are affordable to extremely low income Kentuckians and Americans too. So there is a sign-on letter But really at this point, it is in the Senate's hand. And so we would recommend that people contact Senator McConnell and Senator Paul's office. And I believe that is the end of the housing section. I'll turn it over to Tyler.
Hey, thanks, Adrian. Tyler Offerman with the Kentucky Equal Justice Center here. Going to talk a little bit about SNAP and PBT, some of our feeding programs. So just, big picture, SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps, is always important year-round, but especially during downturns in the economy. That's the way the program was built, and it is functioning that way. So you can see, going all the way back to the last economic downturn during the Great Recession, starting in 2008, you can see SNAP participation go up as the economy recovered. It went back down, COVID hits, folks were in need, and it went back up. It has started to decline over the highs during the winter, also the high of the COVID surge. But we are looking at a little over 500,000 Kentuckians participating in the program, and that's down from our high of almost 650,000. So folks are using the program, which is great, and folks are moving off the program as they find employment, which is also good. Go to the next slide. So just a couple things, folks might be familiar with the emergency allotments, but when Kara listed that laundry list of congressional actions in response to COVID, the emergency allotments were one of them, also called max allotments. So those are dependent on the state having a state of emergency in effect and the federal government having a state of emergency in effect. So both of those are currently still in effect. And with that, the state is granted an allowance to apply for these max benefits every month. What that means is it just takes everyone who qualifies for SNAP. So if you make the minimum requirements, then you get the full amount. And basically as long as your income is low enough to qualify you for the program, it's disregarded when it comes to the actual amount you get, and you just get the full amount. So that is important for a lot of folks and currently makes up about 42% of all SNAP benefits. I mention that because our state of emergency is currently set to expire January 15th. Originally, the governor, y'all might remember, had been extending those. He was sued by the legislature. They took away his power to do that. They set their own timeline. That date is January 15th. So unless the legislature takes action by January 15th to extend that state of emergency, then a lot of folks will be losing benefits. The max benefits will go away, and that'll equate to about $42 million in monthly revenue for farmers and grocery stores suddenly evaporating. So, I feel like we've listed a lot of to-dos for y'all, but in the next month, if you do see your state House of Representative or Senator asking them to extend the state of emergency would be great. My dog agrees. There's just a couple other things on that last slide. One of them is this. So the Thrifty Food Plan is the underlying equation, to simplify it, that sets the amounts within SNAP. The last time those had been updated, I forget the exact date, but it had literally been decades. And the Trump administration, Congress under the Trump administration through the Farm Bill had directed that be addressed. The Biden administration implemented those changes, and it shook out that most people saw an increase in benefits because, surprise, the price of food has gone up dramatically over the last couple of decades. So if you noticed a change in your benefits, that's likely why. So, and just real quick, a side note on this, if you are on SNAP and, we've all been getting the max benefits and we haven't had to worry about it, but they will go away eventually, right? The pandemic God willing, will end. And those waivers that give us emergency allotments will go away. So it's a good idea to check in with your caseworker and make sure that you've got all your deductions, whether that's medical expense deductions or rent or utilities, just make sure it's all up to date. So that way, when the emergency allotments do go away, you are getting the right amount. All right, next slide. Great. A couple things on PBT. This is old information, obviously. All of the past due amounts for pandemic EBT, which again is to replace meals kids missed at school if they went to a qualifying school, which basically means they participated in the free and reduced lunch program. So PBT replaced those meals, putting that money basically onto your EBT card. So all of that money should have gone out from the past school year. If you haven't gotten it, both from the school year and from the summer, make sure to follow up with the cabinet, reach out and make sure you do get, hopefully you can get the money, but at a minimum, you can address whatever problems may have prevented you from getting it before, like an address change or joint custody kind of situation or whatever it might be. And that's important because the next slide, sorry, forgot the Build Back Better plug. By the way, the summer EBT program will not continue. It will not be renewed unless Build Back Better passes. That was a temporary program. So if you like that program, I'm piling on to the Build Back Better bus. So, there we are. Confused parent, what is happening with PBT for this current school year? We still don't know. I wish I had more clarity for you. The state is working on the plan. They may have already submitted it. I have not heard that it's been reviewed by the federal government yet. So obviously that timeline is going to get pushed into next year. Everyone will be getting the benefits they were due back to the beginning of this year. It's really just a question of when does the money start to flow. You all will be the first to know once we get details on that plan going forward. You just want to hit enter. Yep. Last note there, just make sure to keep your card. We still don't know what the process is going to be moving forward. There's been various processes as this program's been rolled out. So just hold on to it. And once we have guidance for where the benefits are going to be going, we will send that out to you. And I believe that's my last slide.
And that means it's back to me. And Emily will come along here in just a minute. Kelly, let's hit the next one. We're going to talk about open enrollment and network adequacy. So the public health state of emergency, like you have heard from a few folks, has been renewed and will last 90 days to January 16th, 2022. And that is the federal and that states will receive a 60-day notice. And then we've got a few other changes to our health coverage, and that we've got some prohibiting of cost sharing, which I hope everybody already knows that, and the Medicaid is back to having no co-pays. And of course that you should have no out-of-pocket costs for your COVID-19 vaccine, no matter what. Please be loud and complain about that if that happens to you. All right, Kelly, let's see what we got next. So we went over this last time. I'm not going to go over it a ton again because nothing has changed, even though it kind of feels like it's changed, because sometimes you go places and the front desk acts like something's different. But the reality is that some insurers, without any change in regulation, have decided to kind of go rogue and say that they're only doing it this is medically necessary, which was the way that some have been doing it all along. It's just not being ironed out very quickly. And of course, it is medically necessary if a doctor orders it, or if you're experiencing symptoms, or if you've been exposed. So that's a pretty straightforward. And then of course, when you get this and you can click on it, there's all kinds of sites where it doesn't matter. They don't ask you questions. You just show up and testing is free and out of pocket. Next slide. Oh, this is just saying how, nobody should be charging you and all that should be true. So, and the General Assembly, of course, extended the state of emergency until January 15th. And then friendly reminder, Medicaid is always open for enrollment. The opportunity to change your MCO, which not that many Kentuckians did, was until December 1st, but you can always still do that for cause. If your MCO is not covering something that you think that they should, you can always still, or they change their network, and that you can always still change for cause if you have a need for that. We are still today is the last day of Medicare open enrollment, which is mostly for older Kentuckians or Kentuckians with disabilities. And then the other very important deadline that is December 15th. So next week is the last day to apply for coverage to start January 1st. That isn't the final deadline to enroll in coverage. That goes all the way to January 15th. But next week, December 15th, is the last day to get your coverage to start January 1st to prevent having a possible gap in coverage. So now is the time to go shop and compare plans on Connect. Connect is up and running. Find yourself a connector and spread the word. The next slide. These are the different value added benefits. So, all 6 of our MCOs, Aetna, Anthem, Humana, Passport, which is run by Molina, owned by Molina, United Healthcare, and WellCare, all 6 of them all cover the same stuff. They all charge a $0 monthly premium. They all have $0 out-of-pocket costs, but they have some very different extra benefits added in. Some have offer glasses and some don't, and some offer dentures and most don't. And they have different packages for memberships and other sort of value adds to help people be healthy. So this is where you can compare to decide if you're trying to choose which MCO. If you are having a problem, because right now it is not the open enrollment time, now it is if you're having a problem you need to change, or if you're newly enrolling, because lots of people are newly enrolling or changing from other coverage, and then you want to compare. That's still an option. We just expanded the number of medical plans. We doubled the number of medical plans offered to Kentuckians on the marketplace, and we added a few blended vision and dental plans. We can go to the next one, Kelly. This is something that I have felt every day the last few weeks that I have been helping folks enroll, and it has been real and amazing. Pretty much every day I have had someone say, I can afford that. This feels like such a good, feels fair, it feels like a good price, feels right. Because if you can look at this, the difference to people's lives under ARPA, which again will continue if we pass Build Back Better. Otherwise, this goes away. This is just for coverage year 2022 under ARPA. So we really need that Build Back Better to keep this going forward. And I know that not every county has all the same plans. And so this is, it's different county to county. I've been mostly enrolling people in Northern and Eastern Kentucky where there have been the increase in plans. I know that's not true in every county statewide, but especially this is the middle example is for a 60-year-old couple. So a common time in life when people come to the marketplace is young adulthood, because you have jobs that don't provide coverage. And then later in life when you're looking at retirement and you're trying to scale back the number of hours that you're working. So if you look at a 60-year-old couple who are making $75,000 a year, they're, under the American Rescue Plan, they're looking at $531 for their premium, which is that's affordable, right? Which is a big difference. So that's what we need to keep. So hence the back to contact our senators. We all have to do it. We just say pass Build Back Better. Let's make it happen. Friendly reminder that presumptive eligibility is still out there. Kentucky allows for 2 periods within every calendar year. And so it's the month of application the following month. Basically adds up to around 60 days, and there's 2 periods of that every year. You should apply for that anytime if you are under 65 and uninsured. And for some reason that works better for you than filling out a full Medicaid application. So there is a public facing P application that we've got a link to here. And currently there are quite a few Kentuckians that are still covered with presumptive eligibility. That used to be kind of a hospital only thing, and we are now keeping it open to the public, which is a good choice by Kentucky. And now I'm going to turn it over to Emily Beauregard to talk about some interesting findings with network adequacy requirements from our MCOs.
Thank you, Kara. Yeah, so this is specific to Medicaid network adequacy requirements. We haven't presented about network adequacy on this particular webinar before, but this is a perennial issue that people with any type of health insurance really experience. But here in Kentucky with our Medicaid program and the 6 MCOs that we have, we know that at times people are looking for a provider in their area close to them and can't find somebody who takes the particular coverage, the MCO that they have. And so what we have learned is that a lot of people don't know what the rules are and what's required of MCOs, and then also what they can do if they're unable to find an in-network provider. So I wanted to just give you a refresher. This is information that Dr. Schuster and I recently presented to the Medicaid Oversight and Advisory Committee, who has also been concerned about network adequacy. And we need to, as a Commonwealth, figure out a better way of ensuring network adequacy and really holding our MCOs and other insurers accountable. This is really kind of a health system issue, unfortunately. So under our law, MCOs are required to actually comply with the exact same network adequacy requirements as other insurers that are regulated under the Department of Insurance. The difference is the MCOs are regulated by the Department of Medicaid Services, but the rules are the same. And there are time and distance standards for different types of providers. So for primary care, for example, delivery sites need to be within 30 miles or 30 minutes, recognizing that 30 miles in some parts of Kentucky could take you an hour or more, but 30 miles or 30 minutes from a residence in an urban area, 45 miles or 45 minutes in non-urban areas. Hospitals, the same sort of rules, 30 minutes or 30 miles from a residence in an urban area, 60 minutes or 60 miles in a non-urban area, and so on. And we can go to the next slide, Kelly. And then there are requirements around appointment availability. So for emergency care, appointments need to be available 24/7. You really can't wait when it's an emergency. That makes sense. For urgent care, appointments need to be available within 48 hours. And then for primary care and other types of specialty care, appointments need to be available within 30 days. For behavioral health and especially for any sort of acute psychiatric care within 7 days. So these are rules that I suspect most people don't know about, maybe even a lot of Medicaid providers and people who are working with Medicaid members, but certainly people with Medicaid coverage may not realize that if they can't find a provider or get an appointment within these these standards, then they have the right to out-of-network care. And so then there's one more set of rules around provider capacity, and that's how many patients a particular provider is expected to see. And we often hear that in certain underserved areas of the state, this is particularly true in rural areas, there's only one clinic or one hospital for a very large region, and those providers can often have patient panels of thousands of people. But the rules are that for primary care, just as an example, there would be one provider per 1,500 people. So that's a little harder for a consumer to ever know, like how many patients does my provider actually see? But these are the rules that Medicaid is meant to enforce. We can go to the next slide. And then I wanted to share, kind of what the status is of network adequacy in Kentucky. And then I'll talk a little bit about some things that we're doing to advocate to improve it. But there was a 2020 secret shopper survey conducted by a group called iPro. They basically serve as a third-party external quality review organization. Every state's Medicaid program is required to have this external quality review. So the company that Kentucky contracts with is called iPro. They conducted this survey in October of 2020, and they called 1,250 providers, randomly selected, and you can see there were primary care, pediatricians, obstetricians like OBGYNs, behavioral health, and alcohol and substance use disorder providers. And they called to ask for routine, urgent, and after hours visits. And then also asked about telehealth availability. We can go to the next slide. And here are the results. About 35% of providers that were called about routine visits were able to actually be contacted. So they picked up the phone and they had an appointment available within 30 days. About 20% of the providers called for urgent visits were able to be contacted. They answered the phone and they had an appointment within 48 hours. About half of the providers, not quite, called for after-hour visits were able to, be contacted and schedule an appointment. And then for the people seeking telehealth appointments, only about 18% of the providers that had a routine visit available were able to do that by telehealth, and less than 4% or about 4% for urgent visits were able to do that via telehealth. Now, this was in 2020. We know that was a challenging year. Providers do have more telehealth capacity now, but you can see this is really concerning. People who, are relying on getting this coverage and having availability or having access to providers into these appointments aren't really getting the access that Medicaid guarantees. And so we need to make some changes to our system to both have more people in the workforce and also enforce these rules. So just so you know, the industry standard in terms of complying with all of these rules is about 80%. And you can see that, we're at a high of 48.5% down to a low of 19.5%. We're really not complying, nowhere near. So something that we are advocating for right now that we recommended to the Medicaid Oversight and Advisory Committee was that first, we have a better idea, better data on our workforce. So there are different boards that are governing different types of providers in Kentucky, licensure boards, and they collect information on their members. And that information doesn't include a lot of very relevant information about, like, are they full-time or are they part-time? Are they practicing clinically full-time, or are they sometimes doing administrative work or perhaps working at a university or college? And there are a lot of providers who may even be retired and are still being counted as in network. There are lots of reasons why the data that we get from licensure boards just isn't accurate. And so we think the first thing that we can do to improve this problem is to know just exactly how many providers we have that are available and are accepting Medicaid and seeing patients. So our first, recommendation is to collect better data and to make it, very comparable across all licensure boards. We need to get apples to apples data. And then there are some other things that need to be done in terms of enforcement. But the other thing that we've done recently is ask the Department for Medicaid Services to give us something simple that we can provide to Medicaid beneficiaries in terms of what their rights are and what they can do to get out of network care whenever they don't have an in-network option. So look for that, in hopefully a month or two. DMS is working on that for us now, and we will share that when it's available. And I think that wraps up my section. Yeah, and I'll turn it over to Marcy Timmerman for her update.
Hello all, forgive me for being off camera. My camera is not working very well today. So I am Marcy Timmerman, the Executive Director of Mental Health America of Kentucky. Go ahead, next slide, please, Kelly. Thank you. So the first thing we wanted to talk about today was 988. So the National Suicide Prevention Lifeline will be accessible through 988. So by dialing 988, similar to the way we dial 911. Right now, for physical health, we can call 988 in addition to 800-273-8255, which is the original line. So they're not doing away with the line phone number. We actually have phone numbers that they published decades ago that are still active and still going there as well. So don't be concerned. There's no wrong number to call. That's actually part of the point. But 988 is a lot easier to remember, especially when you're in an emergency situation. So that actually got passed because of some information in the during the Trump administration. So this 988. So it will roll out whether we like it or not in July 17th of 2022. So I, of course, like it, but it is definitely a lot of work to start a new telephone exchange. But really the point is it's a number to call, and then you're supposed to get someone to help, right? And we actually have seen the number of calls and the severity of calls to the Suicide Prevention Lifeline increase over the time. Over this past few years, especially with COVID and the racial trauma issues that have been happening. So a combination of those things. There's definitely been an increased need for help. A reminder that mental health crisis can happen to anyone. This is not just folks with mental illness, right? Using this number. This is anyone, regardless of your economic, health, race, community, or social support status. So really 988 is going to help all of our Kentuckians. And it gives us a no wrong door. Hopefully we are building up a system where if you have a substance use issue, right, we can tie into 911 as necessary, and that 911 can tie into 988 as well. That's complicated. That's going to take a little while, but that is the goal. When we talk about funding 988, we are going to be asking to pass a fee on mobile services of 70 cents a line is our ask, starting in this session to help pay for an increase of personnel. So, but it's important to note that a fee for us does not take away funds from 911. I think there's been some misinformation out there, so we wanted to make sure we were clearing that up. 911 is wholeheartedly involved in the 988 process here in Kentucky. Our partnership is quite strong, and they really see this as a way to divert calls that they really have no business answering, right? So this is really helpful. Go ahead, next slide, please, Kelly. Thank you. So yes, we do have an event tomorrow to talk about Fund 988 Kentucky and that 70 cents per line fee. And the fee is interesting. I want to make sure that that's clear what a fee does in Kentucky. It actually is managed by a group of people that is appointed in the legislation that allows the fee. So this is a sustainable system, and this is a way to fund it sustainably without having to fight for it every single budget session. And I think that's really important. We shouldn't be having to fight for our right to have people answer the phone when people have a mental health crisis. And this is the way that 911 is actually structured in the state when we have the statewide version of 911. 911 does have fees locally that are different, but we are looking to mirror the way that they function at the statewide level. Our funds will be used for mental health call center staffing. That is really important right now. A lot of our staff are afraid to go to the bathroom because they're going to miss a call. And that shouldn't be happening. We want to make sure that calls are answered regionally or locally. Right now, most of our community mental health centers actually are now answering those calls from the suicide prevention line. And you're getting someone who talks like you, understands you, right? Gets a little bit of your cultural background where you're at in Kentucky, and also knows the resources on the ground better. And that's really much more helpful than someone in New York or Miami answering a phone call here in Kentucky. So next slide, please, Kelly. And I'm happy to answer questions about that anytime. Wanted to do an update on our mental health screenings that are at mhascreening.org. Those are free and anonymous. They're online. There are multiple tests, including a postpartum test now, actually. So if folks are interested in that. But over 17,000 screenings have been happening in Kentucky just for the first 3 quarters of this year. That is a huge increase. We were usually shouting from the rooftops at 5,000 screenings a year prior to 2020. So folks are really adopting the screenings. They're coming to them from different places, our website, social media, a lot of social media, and really just an increased awareness that mental health is a concern, right? So when they're searching for anxiety and depression, they get our stuff. Anxiety and depression are our two both most popular. Depression tends to be the most popular screening. Anxiety and bipolar kind of tend to be neck and neck, quarter by quarter. But both are showing, both anxiety and depression are showing increases in severity as a percentage of those self-selected screeners. So again, these are people who come willingly, right? This is not necessarily a general population conversation. They're also citing that loneliness, relationships, past trauma are really the reasons they're taking the screening. So we ask them to cite up to 3, and those are our most common 3 across the board. All right, go ahead, next slide, thanks. We also have some tips for surviving the holidays, because holidays are always a hard time for folks. Actually, it's one of our second most likely time for folks to have a severe mental health issue or needing that 988 number really. So some ideas for surviving the holidays. have a stress management plan and a personal routine, right? And I say personal routine, doesn't have to be a family routine, right? Getting everyone to fall into line in the same way each year can be very challenging. Have a routine for yourself and a way of knowing how you can step back and take care when you're stressed. Set reasonable expectations for yourself and others. And I say reasonable expectations. I think in the holidays, we can get really carried away by Pinterest momming and other kinds of things. We have to make sure that we're setting reasonable expectations, especially when we're looking at COVID times, right? There will be people who won't be safe for you to be around. And that is okay to have that expectation that you are worth making that boundary. Be conscious of and protective of your limited time. Set good boundaries on your time. Don't say yes to everything. And recognize that some things take longer than you expect. So try to build in some downtime as well. I cannot stress enough, for mental health reasons, maintaining a sleep routine of some kind is so important. Can also be super challenging. There are lots of things going on, lots of stress. The light changing for, we're constantly, it feels like bedtime at 6:00 p.m. here. So that can be a problem with sleep routines. It's important to have one though, and to try to maintain it during the holidays as best you can. When those kids are home from school, keeping them on some kind of sleep routine. Maybe you let them stay up late a couple of nights, but you really want to keep that routine solid as much as you can. An important part of mental wellness in general, I'd say, is naming your emotions and the emotions you're seeing from others. I think naming emotions gives us an opportunity to really take a step backwards and take a look at what's really going on around us. And being able to name something gives you a toolbox that you can use from there, right? You can actually access it. If you know you're stressed, if you know you're anxious, you can open your toolbox to help deal with your stress and your anxiety. As always with the holidays, take time to be a family. So it can be real easy to get distracted and do different activities for different people and go here, there, and everywhere. It's really important that if you have a core group of friends or family, to make sure that you're meeting together and really getting support from one another. And then if you're struggling a lot this holiday, please don't hesitate to see if your employer has an employee assistant plan. A lot of times the employee assistance plans will have free mental health visits with someone who's a qualified professional, up to 10 visits or so free. Those can be just check-ins, right? Just little tune-ups, as we say. And if you need something more severe, they'll actually help you do that through your insurance. And then we do have a discussion on Friday at noon about holiday survival tips. We want you to join us and talk about these, but also other tips that you might be finding helpful. Next slide. Thank you. We always want to make sure that we include the helplines and how to find help. So please make sure you have this information if you need it. Thanks, Kelly.
All right. So before I share some of the resources that we have for y'all, I just wanted to mention, you may have noticed that we are doing transcription for the first time. We have these closed captions, and I think that's pretty cool. I really appreciate the person who recommended or, asked us to do this. It's an option that we just didn't know how to use on our Zoom. So very glad that we have turned that on and hope that it's helpful for some of y'all. I've noticed that it sometimes is over the slide, and I just was kind of messing around with it, and you can move that around. So if it's ever in your way, you can just move it. We can go to the next slide, Kelly. Just want to continue sharing this flyer or explainer that we put together about the American Rescue Plan. We talked about it a lot today. The enhanced savings for marketplace plans, of course, the child tax credit. There's a lot here that people are still eligible for, still need to be taken advantage of. So please share that with folks. And when the Build Back Better plan passes, we will do something similar so that you can educate people in your networks about Build Back Better and all the great stuff in it that they need to be aware of, and making sure that they are taken advantage of. Let's go to the next slide. I think all of this information was presented by Adrian earlier, but we like to put everything at the end of the slide deck so that it's an easy place for you to go and find what you're looking for. We can go to the next slide. The same here. Let's keep going. Yep, let's skip this. Some of this is information we keep in every slide deck, but I know there's going to be a little bit more that we've added. And so I think it's the next slide that I want to stop on. Yes, so Here we have dates for our upcoming 2020 Thrive Kentucky Advocacy Series, these state and federal policy updates that we do monthly, and then our quarterly forums with the Cabinet for Health and Family Services. We have tentative on January 11th at 2 p.m. That's a Tuesday during the legislative session. We've been trying to avoid Tuesdays, but we can't do that in January. So it's 99% going to be January 11th at 2 p.m. and we'll get that information out to everyone soon. But then for the rest of the session, March and April, we'll have Mondays, and then we go back to Tuesdays at 2 for the rest of the year. And we always share this Advocacy 101 training recording from Dr. Schuster because it's fantastic. You can, depending on your, if you have a license, you can use it to get CEUs, and it's just a great resource. But if we go to the next slide, we have an upcoming Advocacy 101 that will be live on January 10th, still virtual, but it will be from 11 to 2 o'clock on January 10th. And we will have 2 legislators joining us. It will be a great opportunity to either learn some new advocacy skills, just sort of be reminded and hone your advocacy skills. I learn something new every time. And it's always great when legislators are joining us. It definitely brings a different element to the training. So you can register at kpa.org. And just another reminder, if you are a licensed social worker or a certified community health worker, you can get CEUs for attending today. You need to email Kelly to get that certificate going. And thank you again to our sponsors. And again, if you're interested in sponsoring for 2022, please reach out. And with that, I think we are done a few minutes early, which is great. If people have any last minute questions, you can throw those in the chat. Otherwise, please just reach out to us. On the next slide, we have all of our contact information. And we'll hope to see most of you in January. And in the meantime, happy holidays. And I hope everyone stays healthy during the holidays and gets a little bit of a break before things start to rev up again in January. Thanks, everyone. Have a good afternoon.